In yesterday's video, I talked about the top 4 issues I see people having when trying to perform the 90-90 supine hip shift. And remember, that exercise is one of the primary exercises that PRI uses to reposition the pelvis. It also has upper body implications because you are exhaling. And exhalation, which we stress on the left side, brings the ribs down, back, and in. And that's what you need to restore the left ZOA. Remember, everything's about getting back this left ZOA and strengthening this left side area of the left side pelvis and the rib cage. But there is one major drawback with that exercise, is because the floor is behind you, you're lying on top of the floor, it doesn't allow for very much posterior rib cage expansion. And that is a really, really important thing on the left side. When you are in the left AIC, right BC pattern, the rib cage, so here's the right side, here's the left side. The rib cage and the spine orient to the right because the pelvis underneath it rotates forward and orients the pelvis to the right, and the spine goes with it, and the rib cage goes with it. In order to stay straight, the rib cage has to counter-rotate back to the left. So it's facing right, and it has to counter-rotate back to the left. In this position, you get 2 areas that get tight in the rib cage. The right side on the lateral wall, also the front part. So the front and lateral upper right chest wall gets tight. The supine 90-90 with hip shift allows you to open up that area as you inhale. As you inhale, because of the position you're placed in, when you close down the left-sided ribs, the right side will open up on the next inhalation, or it should. It doesn't always, but that's the design. However, there's one more area, and it's the posterior rib cage on the left that gets tight and closed down. Those ribs in the back get tight and closed down because the back is arched on that left side. So if you look real closely, so here's the left, the rib cage orients to the right, it side bends to stay up straight, and look what happens to those ribs right there. They tighten, okay? So when the pelvis goes towards the right, this is the position you'll be in, and then it has to counter-rotate. And as you counter-rotate back to the left, the ribs right near the left shoulder blade, scapula, kind of underneath that area, all in here, get tight. And that is the posterior mediastinum, if you've heard that term. But all it means is the posterior rib cage on the left needs to be expanded through inhalation while you inhale. And the supine 90-90 does not allow for much of that because the ground is behind your back. So when you inhale, the back has nowhere to go. So the exercise that I have on my YouTube channel, which is a hands and knees breathing exercise, I just call it kind of left ZOA exercise. That exercise is really good to provide left posterior mediastinum expansion. Now, the important thing is this. When you do it, it's really not that hard. It's difficult, but technique-wise, it's really not that hard. So there's a couple things you have to keep in mind when doing this hands and knees, left ZOA, posterior mediastinum inhibition exercise. First, you have to remain as rounded as possible, okay? So just pretend there's a pillow or a towel underneath my left leg, because that's in the video and you want to use that. So when you round your back, I actually place my right knee forward and my right hand forward. Why do I do that? Because it closes down the left side. Remember, we need to close down the left side. This is that left ZOA. It has to come closer together. The pelvis and the rib cage has to come closer together using these internal obliques. As we do that on exhalation, on the next inhalation, we try to direct air into that area that I was talking about on the skeleton model, the left posterior rib cage. We need to have it expand. And it can only do that if the ribs are back. So when you set up, you have to maximally round your back and then side bend to the left a little bit. And when you do this, as you inhale, the rib cage moves a little bit back towards the ceiling, and then as you exhale, you have to keep that position. You don't want to do this. You don't want to exhale and sink. If you do that, you've lost that expansion position. Now the other thing, if you're going to raise the right arm, you may drop immediately. In that case, you're probably not strong enough to do it, so you can just keep two hands on the ground. Okay? So, when you're in this position, you're rounded, side bend to the left, right arm is up. This gets very difficult very quickly. People will drop immediately if they don't have enough scapular strength. That would be the left serratus anterior and left trapezius, lower trapezius. This all stabilizes that left scapula. But the whole left side is getting worked in this position. And that's why it's really a great exercise, because it expands the posterior rib cage and it strengthens the whole left side, which is usually weak compared to the right side. So this exercise combined with the 90-90 is a great pair of exercises for people who I'm not working with. Right? I can't diagnose anyone, not that I diagnose, I don't know what your issue is, but people keep asking what they should do. Without testing you, without knowing your issues, I can't know exactly what you need and what you don't need, because there are some exercises that I could give you that aren't going to help depending on the situation. But these two exercises are what most people are going to need at one point or another, so that's why I have them actually posted on the website.